Okay.
So first off, Jane, I want you to just tell me a little bit about the history of your sleep breathing disorder and the treatments you had before we started the mRNA treatment.
Yeah, I tried a bunch of different things. The original sleep apnea diagnosis was probably when I was, oh man, it was probably almost 20 years ago. And did some work with a sleep doctor, which was not very helpful. And started sleeping on my side and doing things like that. And then later on at the dentist, it had progressed to moderate sleep apnea. And so then I was fitted for one of the regular oral devices that's just stationary. And that worked for a number of years, and I was happy with it. But then it stopped working, and I started getting the sleep apnea again. And that's when I found out about this device. And so, and what appealed, in the meantime, I'd also tried the CPAP out of just desperation. And absolutely, the first night, I just felt like my head was blowing off, and it was the worst night and the worst following day ever. You know, like the worst drug trip ever. So I was absolutely not able to use that. And then I found out about the VIVOS, the device here, and it appealed to me because it wasn't just a Band-Aid approach, and it was looking at the cause and addressing the cause, not just covering it up.
Yeah. Do you think that the progress you've made with the treatment is something you would like to share with everyone, just from your own words?
Yeah, for the first time, I started sleeping. I have a history of pretty severe insomnia, and so I'm sleeping now.
Yeah, and without the Bluetooth and wirings, and yeah, that's nice, because I know you were sensitive to that.
Very much
just
so.
Reverse engineering you, and this is nice. I mean, there are people that still can respond to CPAP, and I know that those that don't are not able to breathe. And I think one of the things that I've noticed with you since the year that I've worked with you is you're breathing better. And I can tell the difference in your skin tone from the start to mid-treatment, just progressing. Yeah, I just love to know that, because these are treatments that are available. There are things we can do. And unfortunately, not many people know about it. So yeah, I'm glad that you shared. Thank you. So how do you feel about your results? How do you feel about the whole treatment?
I'm pretty happy overall. My goal would be to not have to wear it at all.
Yeah, we're getting there.
That would be fantastic.
We're getting there. We're in the yellow zone.
Yeah.
We're just as close to green. Well, good. Thank you so much for sharing that. Thank you.